everyone, and welcome to And Sleep. My name is Tommy Licatese. I have the pleasure of hosting allergist Dr. Clifford Bassett. Today we'll be discussing modern allergies and sleep. Welcome to the program, Dr. Bassett.
Thank you for having me.
So can you describe the different categories of allergies and the symptoms associated with them?
We've known for many decades, not only in the United States, but throughout the globe, allergies are on the rise. And what's our friend behind that? Not so much our friend, global climate change, carbon dioxide, rising temperatures, longer growing seasons, there's more pollen in the air. And it's not just pollen, it's pollution. There's a combo effect, which is a synergistic effect that can take a pollen grain and make it more powerful. So people are exposed to more and more pollen. They can't escape it and go to the southwest or move away from it. There's always a pollen season everywhere. So as a clinical allergist taking care of adults and children, I'm seeing more patients with allergies at all ages. I see people in their 50s and 60s and beyond who have allergies for the first time. One of the most important factors for a family to know is genetics. If you have one parent with allergies, there's about a 1 out of 3 chance the child will develop allergies. 2 parents, it's about 75%. So largely genetic, plus there is an environmental component.
Besides pollen, what are some of the other environmental allergens or other allergens that affect your patients?
Well, indoor allergens are definitely important. And what we're seeing is greater exposure indoors, more energy proofing of the buildings, whether it be an office or your home, less ventilation. And that means exposure to indoor allergens. So when we're talking about indoor allergies, we're talking about dust mites, and we're also talking about pets. 50% of US households have pets, cats and dogs alike. When I tell people to get rid of their pet, they say no problem. But if they have a cat, they say, I'll leave my allergist behind. People love their cats and they're very attached.
So who's the most vulnerable to, having these symptoms?
Basically, anybody's vulnerable if you have an allergic predisposition. We call that atopy or atopic. And those are asthma, eczema, atopic dermatitis, food allergy, seasonal allergies, year-round allergies. And the medications we use for them, antihistamines and so forth, despite the TV commercials, they're good for indoor allergies and outdoor allergies. So basically, we're working at the world. We're looking at people that are sensitive. As far as allergies, 10 to 40% of the United States have either allergies, 100 million when you include asthma. That's a very large percentage of people. And so my job as a clinical allergist is identify what are the triggers, how to modify the environment, and how to educate people to live with Mother Nature, whether it be outdoors in a park or home in their bedroom or their house with their loved ones. So allergies are treatable. In fact, allergies are preventable.
We mentioned the outdoor allergens, your pollen, your indoor allergens, the mold and dust mites. But what does this translate to in your patient base? What are the symptoms?
The symptoms are chronic nasal congestion. Those of people who have chronic allergies, they may have blocked nose, nasal passages, sneezing at times, itchy eyes, nose, and throat. They may have postnasal drip. And those are symptoms that can occur over a few days, and that we call that like an intermittent rhinitis or intermittent allergies. And you can have persistent allergies over time.
How do the symptoms associated with these allergies actually affect patients' sleep?
Well, that's a very good question. Whenever you don't sleep well, you have to look to see why. Nasal congestion, nasal blockage, it causes a variety of mechanisms in the body and can affect the immune system, and that leads to what we call sleep disordered breathing. That's why during the pollen season, many people come in and say, I have this and that, my nose is troubled, but I'm always tired. What's going on? Most likely is they're not getting great sleep because of the congested nasal passages that are not being optimally controlled, leading to poor quality sleep, and that's something we talk about every day in sleep medicine. Poor quality sleep leads to daytime inattentiveness, drowsiness, and loss of productivity, and learning in the classroom for children. That's been done in many studies now looking at the impact of poorly controlled allergies on our quality of life.
So how are you screening your patient base for sleep breathing disorders, and what do you do next?
What I'd like to talk about for a moment is sleep questionnaires. It's an objective assessment that they can fill out along with their loved ones or their physician, and they can fill in information that leads us, do I have a sleep disorder? Are my symptoms worth having a home sleep test, an HST? First thing is a home sleep study. That will give you certain numbers and compare you where you should be and indicate if you have obstruction at night, your oxygen saturation, other measures. I refer them to sleep physicians, both ear, nose, and throat physicians who work closely with sleep dentists, as well as respiratory medicine physicians to determine what do they need for their treatment. Dental appliance is becoming more and more valuable for many people in trying to correct their nighttime anatomy, so to speak. And also all those things that go along with sleep apnea and the risks involved to human health. So it's no joke, there's 1 billion people out there that have it. Many of them don't even know it. By having a sleep questionnaire and working with a collaboration of physicians that are dedicated to understanding sleep, how it impacts an individual, whether it be a child or an adult, is very essential in understanding this problem and trying to do great strides in improving it. There's an unmet need in this country, and sleep medicine is one of the ways we can actually identify people at risk, educate them, and come up with real-world options for their health today and every day.
Wow, that's very interesting. Thank you for coming onto the program, Dr. Bassett.
Great to be with you.
Well, that completes this episode of And Sleep. Explore the rest of the episodes on wholeu.com to learn more.